Most of the anatomical words are in Latin. Most of the clinical words are in Greek. So let's start with the word anatomy itself. Ana is separate. Tom is to cut. Coming from the Sanskrit word tama, which means to cut. So cut and separate is the literal meaning of the word anatomy. Why? Well, how do you study anatomy? Dissection. Cutting, separating. Cutting, separating. That's how the word anatomy has come. The other word is dissection. It's a Latin word. Dis means separate. Section means to cut. So dissection is cut and separate. So literally, the Greek word anatomy means the Latin word dissection. That's how anatomy used to be studied earlier. Nowadays we have got various imaging modalities, X-rays, CT scan, etc., while we can study the interior. Earlier times this was the only method. Let's take another example. Cardiology. You heard of this word? Cardiology. It comes from the Greek word cardi, C-A-R-D-I, followed by logy, which means the scientific study of. Cardi, C-A-R-D-I, cardi means heart. Logy is study. Whenever logy is just a suffix, cardi is a noun, study of heart. Whenever you are connecting a noun with a suffix, if the suffix starts with a consonant, L-O-G-Y, then you have to use a connecting word, and the connecting word usually is O. So cardiology comes from three words, cardi plus O plus logy. Clear? And likewise, we have so many other specialities. Dermatology. Dermat means skin. Or connective logy. You consider the word inflammation. Inflammation means burning, fire. So when there is an infection in a certain part of the body, that part is burning. The suffix for inflammation is itis, I-T-I-S. So suppose there is an inflammation of the heart. What is the word for heart?
Cardi.
Cardi. And what is the suffix for inflammation?
Itis.
Itis. But itis starts with a
I.
which is a vowel. So you don't require an O to connect vowel starting suffixes. So it becomes carditis. Because there are two consecutive I, one I is dropped. Okay? Carditis. Is it clear now how we sometimes use O, sometimes we don't use O? It means other suffix. There are prefixes also. For example, pericarditis. Peri means all around. So the inflammation of all around structure of the heart is pericarditis. So I use a prefix, use a noun, use a suffix. Inflammation of the stomach. What is the Greek word for stomach?
Gastric.
G-A-S-T-R. G-A-S-T-R. Gastro. So, itis with gastritis. Gastritis. Inflammation of stomach and intestine Enterocide is enter, E-N-T-E-R, enter. If it was inflammation of enterocyte, it will be enteritis. Study of enterocyte is enterology. What is the infection of stomach and intestine? Gastroenterology or gastroenterology? Enteritis. I will say enter starts with the vowel.
Two vowels cannot come together.
But G-A-S-T-R is not a vowel.
जी.
G-A-S-T-R is not a vowel at all. We have said with the connecting word, suffix starts with a consonant, you require O. When the suffix starts with a vowel, you don't require O. But remember, enter is not a suffix. Enter is another noun. When you are connecting two nouns, you have to use O. Okay? When you are connecting a suffix starting with a vowel, you don't require O. It is clear so far. So it will be gastroenteritis. Is this point clear?
Yes.
Two nouns connected to each other will be always have an O in between. You cannot combine two nouns directly. But suffixes and prefixes don't require this. Don't follow this. Is it clear? Pathology means any disease, not necessarily inflammatory disease. Pathology, the word for pathology is path, P-A-T-H, P-A-T-H-Y, pathy. Suppose there is a pathology of heart and its muscle. Cardiomyopathy. Cardiomyopathy is what? Pathology of heart and muscle. Cardiomyopathy. Is it now clear how we make up new words? Let's deal with some speciality. The second subject that you will learn in the first year is physiology. P-H-Y-S-I means growth. Growth. The scientific study of growth is physiology. P-H-Y-S-I-O-L-O-G-Y. Physiology. Actually, physiology deals with all the functions of the body, including growth. So actually, physiology is a narrow word, but it's a very broad speciality. Biochemistry is something which you already learnt in earlier classes also. Bio means life. Chemistry is chemistry. Chemistry comes from Arabic word alchemy. Alchemy is black magic. So then they use all some different color solutions and create different colored solutions, almost like a magic. Second year when you go to, you learn the scientific study of drugs. Pharmacology. And then the study of, here you learn normal anatomy, in second year you learn abnormal anatomy. Abnormal anatomy means pathology. Okay. A branch of pathology which got separated from pathology some 50 years back is now given a special category where they deal with organisms that cause the disease.
Microbiology.
They call it as microbiology. Micro, one word, bio is another word, logy. But not only they deal with microorganisms, they also deal with large parasites like worms, etc., which you can see with your naked eye. So there that branch where you are not dealing with microbes, they call it as parasitology, a sub-branch of microbiology. But they are parasites, parasitology. And viruses they study ultramicroscopic are called as virology. And the other bacteria which are seen under the microscope, they call it as bacteriology. So microbiology is subdivided into three subspecialties: bacteriology, virology, and parasitology. In the third year, you learn community medicine, which was formerly called as preventive and social medicine. Now they call it as community medicine. Still earlier, community medicine was not a special subject. It was considered as a part of medicine. And they used to call it as hygiene. Hygiene means cleanliness. And cleanliness is a preventive form of disease. Now it's a special branch by itself, where the primary focus is on prevention, the secondary focus is on early intervention, so the disease does not progress too much, and instead of patients coming to the hospital, doctors go to the patient, they go to the community. That's why they term community. And there are others like otorhinolaryngology. Oto means ear. Rhino, nose. Laryngo, larynx. Actually, larynx in this context refers to the entire throat. So ENT specialists are called as otorhinolaryngologist. Sounds so much more learned. That's by adding some Greek words, you can now confuse the lay public. Oh, I went to the otorhinolaryngology this week. Where did you go? And of course, the eye specialist is called as
Ophthalmologist.
ophthalmologist. How do you spell opthal?
OPTHAL.
In MS ophthalmology, just before when the examiner is deciding pass or fail, they ask you to spell ophthalmology. And if you spell it as OPTHAL, it is not ophthalmology, it is off. So how do you spell photograph?
Photo. PHOT.
PH, right?
Yes.
So first sound is PH, not PT. So it is ophthalmology. OPHTH. Is it clear? They say if you can't name your specialty, if you can't spell your specialty, how can you pass? Just one question, if you give the wrong answer, come back after 6 months, learning the spelling of your specialty. Sometimes anatomy teachers also make mistake. One word is oculomotor. You must have heard this in your 11th, 12th channel as a third cranial nerve, oculomotor. Have you heard of this?
Yes, sir.
Yes. So how do you spell oculomotor?
OCCULO.
O double C or single C?
Double C.
Oculomotor is spelled with a single C. OCULE, ocule means eyeball. The nerve which supplies the muscles that move the eyeball is a motor to the eyeball, is oculomotor. Don't confuse with this the word occult. Occult means traces of. That is OCCULT. So when there are traces of blood in the stools, they will say occult blood. That is double C. And because that is double C, people make this mistake of calling it as oculomotor. It is not oculomotor, it is oculomotor. Is it clear? So if you get a theory paper which says OCCULOMOTOR, if you write such a nerve does not exist, you should get full marks because you are right. But you don't get because the examiner thinks you have made a mistake. This is the correct word. Okay? So remember, there are two golden rules of examination. Rule number 1, the examiner is always correct. Rule 2, in the event of the examiner being wrong, refer to rule 1. So do not argue with examiners. What is MD? Right now you are learning MBBS. That also full form you don't know. Forget that we don't MD have going except ahead. What is MBBS? That is should be BMBS. It is Medicine Baccalaureus and Bachelor of Surgery. So what they are doing is Bachelor of Surgery in English, but the Bachelor of Medicine is Latin, and in Latin adjectives are placed after the noun. So Medicine Baccalaureus and Bachelor of Surgery. So what is MD? Medicine Doctor. And what is MS? Master of Surgery. So medicine again uses Latin and surgery uses English. Super specialty of medicine is DM. DM, Doctor of Medicine. Super specialty of MD is DM. And super specialty of MS is MCH. What is MCH? Master of Chirurgy. CHIR, word means hand, HAND, hand. ERG, URG or ERG. You heard of ERG in physics? ERG is a unit of
Energy.
energy. Work. Unit of work. Which is energy. So, hand work. Who works with the hand? Surgeons. So, Master of Chirurgy, MCH. So what are they doing? Because they have used English in MBBS, surgeons, because they use English in Master of Surgery, they suddenly switch over to Latin when you go higher up. The reverse for MB, MD, dear. Okay? Just to sound different. So surgeons initially were very basic English. When they go higher up, they want to sound more learned. So they use Latin. So medicine, surgery, gynac is female. Study of female reproductive organs is gynecology. Okay? Technically speaking, study of females would be gynecology. Gynecologists restrict themselves to the female reproductive organs because there are other specialties for the other organs. PED, P-A-E-D, PED, means a child. Study of child is called as pediatrics. Ortho means straight. Child, we have already said, is PED. So when a child is born crooked, and then he is made straight by some surgery, that field of surgery is called as orthopedics, where you are making the child straight. Of course, orthopedics is now not restricted to making a child straight only. There are so many other things which come in. But the original word came from crooked children are made straight by that specialty. So we'll stop here, continue again tomorrow.